I've worked in care for 4 years. I've been with my current care agency for a year. And at the beginning of April, the situation obviously started getting more serious and more severe. Lockdown had been announced, and I was just really concerned about how this virus would affect me because I have asthma. And while I didn't meet the criteria for the extremely vulnerable list, I was still really worried. And I hadn't really heard anything from my care agency about how they were going to deal with this or what they were doing to help us. So I didn't feel like I was getting any support that sense. So I rang my GP and explained my situation, and he supplied me with a fit note, which basically stated that unless I was able to maintain social distancing and keep a 2 metre distance between me, members of the public, staff members and clients, I was unfit for work, which obviously in care is impossible because you're constantly in people's personal space. So when I found this out, I rang my manager straight away and explained to her what my GP had told me and that I needed to be placed either on sick pay or furlough. And she didn't really express any sympathy or concern for my situation. She just said she'd pass the message on to HR and they'd get back to me. So it took, I think, 3-4 days until I finally heard back. And the email from HR basically said that I wasn't planned in for any more shifts after the 4th of May, so I wasn't eligible for sick pay after the 4th of May, even though that rota hadn't been made yet, which is why I didn't have any shifts. I had shifts up until the 4th of May, but they'd been taken off me. So I wasn't eligible for sick pay in the weeks of April, and because I didn't have any shifts planned, they would be terminating my employment because they didn't have any work for me. So this obviously really upset me because I basically went from working 50, sometimes even 60 hours a week to being unemployed. And the only reason for that was because I asked for sick pay and furlough because I was looking out for myself. So I rang the woman who sent me that email and she didn't really listen to anything I had to say. I just wanted to talk to her and explain that I'd done my research and I knew that I was eligible. But she didn't listen. She basically told me that what she'd said in the email was right and I shouldn't be complaining. It is what it is, and they weren't going to be engaging with me anymore. So it wasn't my proudest moment, but I got quite upset and I started crying on the phone. And as I was trying to compose myself, she said to me, "Right, if you don't have any more questions, I'm going to go. Okay, bye." And she just hung up on me. They didn't offer any sympathy for the fact I'd been working without any PPE before, except for gloves. I didn't have an apron, I didn't have a mask, I didn't have a visor. I was being sent all over Greater Manchester, even though I normally only work with one family. So they weren't protecting me. They weren't doing what they could do to help me. I was really lucky that towards the end of April, I found out that HMRC had opened up a helpline for people for furlough, for businesses, for employees, questions about furlough. So I contacted them, explained my situation to the lady on the phone, and she confirmed that I was indeed eligible for furlough. You're eligible for furlough if you have an underlying health condition, whether that's an extreme one or a minor one. You are eligible for furlough if you're on sick pay. You're eligible for furlough if you are a key worker. So that was a massive relief because then I knew that I was right, but having it confirmed just gave me that extra bit of courage to just keep on fighting this. So I sent one last email out to this person from HR and just said to her, "Look, I rang HRMC. They confirmed to me I'm eligible. Please, 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 please ring them too and just find out for yourself." So I got an email after that with a furlough proposal. So obviously it worked out in the end. And the thing that bothers me most is that I was talking to staff members before I went off on furlough that were even on the extremely vulnerable list because of severe asthma or because they've had an organ transplant, and they were still working. So when I told them that they were eligible for furlough, they said they'd look into it. But it really shocked me that as a care agency, they didn't reach out to any of the employees to just ask if they were vulnerable or if they had underlying health conditions. When you start your employment, you fill out a health questionnaire, so they were aware of any serious problems that we might have had, but they just didn't invest any time in finding this out. we didn't have the appropriate PPE. Like I said, I work with normally just one family, but I was being sent to so many different clients with different staff members. Clients weren't adhering to social distancing all the time. Other co-workers weren't always adhering to social distancing. So it was just a really tough situation to be in. And I was lucky that I managed to fight this. But I wouldn't be surprised if there are still many care workers out there unaware of the fact that they are eligible for furlough. I just wanted to make this video because what Unison is doing is really close to my heart. I feel that the care industry needs to change. These 0-hour contracts need to go. We need to have better pay. We need to get more recognition for what we're doing. We're looking after extremely vulnerable people with a lot of responsibility on our shoulders, with very, very little training. And you shouldn't have to make a choice whether you're risking your health or your financial situation, which is a situation I was placed in. And even when I expressed this to HR, that I felt like they were forcing me to go into work, even though they weren't aware I had an underlying health condition, I was told it was my own choice to go to work or not. If I decided not to, then that was also fine. But I make close to minimum wage. I can't decide to go off to work. So please sign the petition that Unison has started. They are doing such good work to make sure that we carers are better looked after, because that's what we need.